So two settings that I'm interested in working are just mental health and substance abuse. I worked for a few years and still do every once in a while with the substance abuse population. I've worked in an inpatient setting, outpatient, and also detox services. Particularly, I like working with interdisciplinary teams and advocating for the client in every domain. And I have worked with interdisciplinary teams. I've worked, whenever I was working at the rehab, I worked with just other people in the substance abuse field, or they may have been going into social work, but it was all for, we didn't have any medical staff or anything like that. So what I appreciate about where I'm working now is I have the ability to work with interdisciplinary teams, doctors, nurse practitioners, nurses, and so forth, and other social workers. And then one of the trends that I see, especially in inpatient care and in detox services, is quick discharges, especially due to insurance denials, or just they're kind of trying to rush them out quickly. So it's difficult to take the time with the client to get them where they need. And sometimes it really does take a lot of critical thinking and thinking on your feet and using just the resources that you have on hand and advocating for the client as much as possible. And that's where some social workers come in as well, being able to advocate for the client or get involved in some way with prolonging the duration of treatment. But also being able to plan in a way that considers barriers that cannot be avoided, such as insurance denials or early discharge, especially in detox where it's usually 4 to 5 days. So within that short amount of time, it's important to get them to the next step, whereas in a 28-day program you have more time, and it's more toward the end that you work on those discharge goals. So every setting and every modality has kind of a different skill set to employ. So I'm excited about this semester because I'll be doing my internship at Vantage Point, which is a mental hospital. And so I'll get to work with mainly a mental health community, a little bit in particular with substance abuse clients, but not as much. So just because I did tell them I wanted to work with populations that I've never worked with before. So I get to play around with that a little bit, and yeah.